Memory loss isn't the only sign of dementia. A list of 5 red flags that might be warning signs of brain changes. Running red lights, falling for scams, shutting off friends. Memory loss is the best known symptom of dementia, particularly Alzheimer's disease. But experts say there are other warning signs that can signal early brain changes. Ones that are especially important for types of dementia in which forgetfulness is not the primary symptom. Just like occasional lapses in memory, these issues can also be attributed to other age or health-related changes, or just a bad day. So experts emphasized that they aren't necessarily red flags for dementia in isolation, but especially in combination, they might be a sign that it's time to see a doctor. Financial problem, sleep issues, personality changes, driving difficulties, loss of smell. Financial problems. People with dementia can experience money problems or declining credit scores years before memory loss or other cognitive symptoms emerge. They might forget to pay their bills, for instance, or no longer be able to stick to a budget. One of the reasons why financial mismanagement can be a sensitive indicator is just because it's so complicated, involving the interplay of multiple brain regions, said Dr. W., a professor of neurology at the University of California, San Francisco. Consequently, finances can be one of the first areas where cracks in someone's cognition start to appear. Poor financial decision-making is especially a concern for those with frontotemporal dementia, a relatively rare form of dementia, where judgment is affected very early on in the disease. Some people with this condition might make the big impulsive purchases. Others might trust people they would not normally, increasing their risk of being scammed. Sleep issues. Sleep disorders can become more common as people age, and older adults tend to sleep more lightly and go to bed and wake up a little earlier than they used to. That is completely normal. But if there are drastic changes in someone's sleep habits, where they are starting their morning at 3 a.m. or are unable to stay awake during the day, it can be a sign of dementia. Some of the brain regions, like in the brainstem, that are really important for regulating sleep and wake cycle, are the first that are affected by Alzheimer's disease, said Joe, an instructor of neurology and neurological sciences at Stanford University. So years before someone has any signs of a memory symptom, they might experience changes in their sleep patterns. One change that can occur specifically with dementia with Lewy bodies, another type of progressive brain disorder, is that a person might begin acting out dreams. This is also true for Parkinson's disease, which is related to dementia with Lewy bodies. Ordinarily, our muscles become paralyzed while we are in REM sleep, which is when we tend to have the most vivid dreams. But in these two neurodegenerative disorders. Toxic proteins attack the cells that control sleep paralysis. This condition, called REM sleep behavior disorder, it's not just normal sleepwalking or sleep talking, said Dr. R., a professor of neurology and neurosurgery at McGill University. At his clinic, patients usually come in after their bed partner has told them that they were hitting them, screaming, yelling during their dreams. Personal changes. In a study published last year, researchers found that people with dementia experienced slight drops in extroversion, agreeableness, and consciousness before they showed any signs of cognitive impairment. Those personality changes accelerated as more dementia symptoms emerged, said a professor of behavioral sciences and social medicine at Florida State University, who led the study. While the research was conducted using a standardized personality test, there are a few changes in everyday behavior that you can watch out for. A decrease in extroversion, for example, may look as if a person is becoming more withdrawn or narrowing a social circle. It may be easier to tell that someone is not going out as frequently anymore than to recognize how much their memory has declined, Dr. S. said. Some of these personality changes might happen spontaneously, and they may be the result of the damage occurring in the brain. With the frontotemporal dementia, for instance, a decline in agreeableness, with the person becomes less trusting and friendly, is linked to decreased brain volume in the frontal cortex, are key components of the condition. Other times the changes might arise because of the cognitive symptom. For example, a person with Alzheimer's disease might appear to be less conscious, becoming increasingly disorganized, or having difficulty completing work or household tasks as memory declines. Driving difficulties. Along with handling finances, driving is one of the most complex cognitive behaviors people perform every day. G, an associate professor of neurology at Washington University in St. Louis, has demonstrated in his research that problems behind the wheel can manifest years before they do elsewhere. Driving is this ultimate blend of the cognitive system, Dr. B said, and if there's one thing that's out of whack, that unfortunately will compromise and shift the driver from being in control to being at a risk for a crash or collision. Cognitive impairment can show up as scratches on a car, getting into a fender bender, or a near miss, or running stop signs or stoplight. People may also brake or accelerate suddenly or take turns too fast. As a result, Dr. B said that they may stop driving as much, especially at night, in bad weather or during rush hour, or they may feel reluctant to drive with grandchildren or other passengers in the car. Of course, other physical issues that can occur with old age, like vision problems, neuropathy, or medication side effects, can affect people's driving. But if you notice troubling changes in someone's ability It might be worth having the car key conversation. Lots of smell. Parts of this brain that control smell, known as the olfactory system, are among some of the first areas damaged in Alzheimer's disease and dementia with Lewy bodies. This is also the case for Parkinson's disease. Many people with this condition begin to lose their sense of smell years or even decades before the symptoms appear. Unlike hearing and vision loss, which can be risk factors for dementia but are not thought to be caused by the disease, loss of smell appears to be one of the earliest indications of neurodegeneration. Different types of brain disease seem to affect people's sense of smell in different ways. For example, people with Alzheimer's tend to be able to detect an odor, but they may misidentify it. They go, "What a lovely smell. It smells so sweet. It must be gasoline." Dr. P said. In contrast, he added those with Parkinson's and dementia with Lewy bodies are often skeptical that I'm even giving them a smell at all.